The FHSC currently comprises investigators from 68 countries worldwide, and the FHSC International Registry includes data on over 62,000 cases. We assessed the adult data in the FHSC registry stratified by gender. We found that there are some gender differences or disparities. In summary, we found that women were diagnosed slightly later. They had lower prevalence of cardiovascular disease, in particularly coronary artery disease. Despite LDL cholesterol were close between men and women, they would tend to be slightly higher in women compared to men. And when we assessed how these patients were managed, we found that women tend to be less frequently on lipid-lowering medication, and they were less likely to attain the LDL cholesterol goals as recommended by guidelines. Perhaps there are a perception of risk that is lower in women than men, and perhaps this is one of the reasons why women are less frequently on lipid-lowering medication or in combination therapy. The results we presented in children included almost 8,000 children and adolescents before the age of 18 years. Most children were diagnosed using the DLCN criteria, and we found that also the LDL cholesterol levels were quite high for children. They were still lower LDL cholesterol levels than those we found in adults in the same FHSC registry. It may have implications in terms of the diagnostic criteria at the time of considering the LDL cutoffs to suspect or identify FH in children. Less than half of the children were receiving lipid-lowering medication. And when we compare the levels of the LDL cholesterol levels of those children who were on treatment and those who were not receiving any lipid-lowering medication, the differences between them, there were not much at all. It may suggest that children are undertreated, either because they are not treated at all, or when they are treated, they are not receiving optimal therapy, and there is still room for intensification of therapy.